Okay, so you've gone through initial treatment for multiple myeloma. First of all, that's a huge step. But what comes next? It can feel a little uncertain, right? Well, this explainer is designed to be your guide, to help you understand everything from monitoring your health to knowing what to look for when it comes to a potential relapse. Let's dive in.
And that is a huge understatement, isn't it? It's a reality so many people face every single day. The whole point here isn't to add to that challenge, but to give you clear, straightforward information, the kind that helps you feel a bit more in control and ready for whatever the road ahead has in store.
So you've finished your initial round of treatment. That is a massive milestone, and you should be proud of that. Now, the focus just kind of shifts. We move from active treatment to what you could call active monitoring. This becomes your new normal, a period of just keeping a careful, watchful eye on things.
So how exactly do doctors keep you safe during this time? Well, a lot of it will probably feel familiar. They'll use many of the same tests from when you were first diagnosed. Now, that's not to cause any alarm. It's all about building a clear picture over time. This lets them see how well your treatment worked, keep an eye on any side effects, and, this is the most important part, catch any signs of the myeloma returning as early as humanly possible.
All right, let's talk about some of the specific words you might start to hear from your care team. You know, a word like relapse can sound really big and scary, but understanding what these terms actually mean, well, that can take away a lot of the fear and uncertainty that comes with them.
This is such a common question, and it's a really important one. You might hear doctors use both relapsed and refractory, and they sound kind of similar, but they actually describe two pretty different situations. So let's break that down, nice and simple. Okay, let's look at this side by side. On the one hand, you've got relapsed myeloma. This basically means the cancer comes back after you've had a good period of improvement, a time when you were off therapy. Then, on the other hand, you've got refractory myeloma. This is different. This is when the cancer either doesn't respond to a treatment in the first place or it starts to progress very soon after, within about 60 days. So you see, it really all comes down to timing and how the cancer is responding to the medicine.
Knowing the definitions is one thing, but knowing what to look for in your own body, that's what gives you power. This next part is all about being aware of what's going on with you so you can take action right away if you need to. And here it is. Honestly, if you take away only one piece of advice today, let it be this. You are the first line of defense. You know your body better than anyone. You know what your normal feels like. So if something, anything, changes suddenly, your healthcare team needs to hear about it. Immediately. Don't second-guess yourself. Don't wait. Just make the call.
So, what kind of changes are we talking about? It could be things like a new, sharp pain that wasn't there before, or some new swelling, maybe a fever. But really the most important one is that last bullet point. Anything that just feels unusual or unexpected for you. Trust your gut. It is always, always better to call and find out it's nothing than to wait and wish you had. Now, if a relapse does happen, the most important thing to remember is that there is a path forward. There are options. So let's take a look at the strategies and treatments that doctors can use to build a new plan that's made just for you.
At first glance, this sentence might sound a little uncertain, right? But I want you to see this as a huge positive. It's actually a really good thing. It means that your treatment is not going to be some one-size-fits-all, cookie-cutter approach. Instead, your doctor is going to create a plan that is highly personalized specifically to you and your situation.
Think of this as the incredible toolkit that doctors have to work with today. And each category of tools works in a different way. You've got things like immunomodulatory agents, which help your own immune system get back in the fight, or proteasome inhibitors, which block the pathways that cancer cells need to grow. Your doctor will figure out which of these, or maybe what combination of them, is the right approach for you, along with other established options like chemo or a stem cell transplant.
So how do they choose the right tools from that toolkit? Well, it's a very thoughtful process. They're going to look at a few key things: how aggressive the relapse is, what treatments you've already had, and how long they worked for. And just as important, maybe even more important, is your overall health and what your personal goals are. This is a conversation, a true partnership.
So after all of this, what does it come down to? It comes down to you being an active, empowered partner in your own care. And maybe the single most powerful question you can ask your doctor is something like this: what are our goals for this next treatment, and how can I best help us get there? You see, a question like that, it opens the door. It makes it a collaborative journey, and it ensures that the road ahead is one you and your team are walking together, every step of the way.